My name is Michelle Thompson, and I'm so excited to be here with you today to give you some strategies and support as we navigate caring for and working with vulnerable children. This video explains the neurobiology of trauma. Studies show that when a person experiences a traumatic event, the brain is literally changed. Wires, connections, all the things that make a brain what it is changes when one experiences trauma. Now think of the children that enter our home. They have experienced an extreme loss of being removed from their primary caregiver. In addition to that, they've experienced the trauma and the traumatic event that led to their removal in the first place. Abuse and neglect, it all plays a role in brain development. Stressful situations, substance abuse, a parent in prison, or even homelessness can all affect a child's ability to cope and how their brain develops. And the first 2 years are critical. There is supposed to be this ebb and flow of a baby saying they need something and a parent responding, meeting that need. For example, I am hungry, you fed me. I am tired, you laid me down for a nap. My diaper is wet, you changed it. All of this reciprocating back and forth teaches a child that they are saved and they are loved. This helps the brain to develop normally. But then when there's a disruption in that can change the brain and how it reacts to different circumstances. A child may be told, you are safe, you are loved, you are fed, you will not go hungry, but their brain is wired differently. They know hunger, they know loneliness, and they know fear. And so that is what they're going to be resorting to even years after the traumatic event. One of the challenges with children experiencing trauma, specifically under the age of 2, is that they don't have the verbiage to be able to explain what they're feeling. For example, they may have experienced hunger early on and not having that need being met of when they were hungry, they were given a bottle. And so as they get older, that base of fear is still in their brain. And so they may feel this sense of hunger and panic, and they might not know where it comes from. With coaching and scripting from the caregiver, you can teach the child to put words to their feelings. I used to feel hungry, and so now I'm feeling hungry and it makes me feel unsafe. I used to feel lonely and was left alone, and so now when I'm left alone, it makes me feel scared and unsafe. We can give those kids reassurance by giving them words to what they're feeling. For younger children, this calls for an extra dose of nurture and affection. We might find ourselves that it's beneficial to go back to the beginning, swaddling, rocking, giving bottles. All of this may feel silly and that the child is too old, but it really does help their brain know that when they have a need, the primary caregiver meets that need. I am tired, you rocked me to sleep. I am hungry, you gave me food. It may feel like you are doing this over and over with no end in sight, but I can promise you it really is helping those connections in the brain and helping the child to heal from the trauma that they endured when they were little. The ACEs study showed that 67% of the population has experienced at least one traumatic event. When we look at that as a whole, we're dealing and working with a bunch of wounded people who've experienced traumatic events. I think it's important to practice universal precautions, not only with the children we're caring for in our home, but as a general rule with dealing with people. Similar to in a hospital, how they would deal with blood, they would treat all blood as if it's infected. They don't know which blood is infected, so they're going to treat all blood the same. They're going to use gloves, they're going to clean it with proper cleaning products, they're going to sanitize things. This is similar to working with children in foster care. We don't know who has experienced trauma or to what degree, so we are going to assume that all children have experienced trauma and we're going to treat them in the same way. This is practicing universal precautions. An example of this would be if a child was asking for a snack and the parent gives a simple answer of no, it's almost dinner time, and the child loses their mind. They rage and melt down, and the parent could be totally confused. Where did that come from? That came out of left field. Why are they reacting that way? That's a perfect example of a trigger response. That child had possibly been hungry in their past and their body's remembering that hunger, and the being denied the snack could have triggered something in them. And so a way of practicing universal precautions is the parent could simply say, no, we're not going to do a snack right now, but let me give you a granola bar. You can keep that granola bar in your pocket, and even though we're going to have dinner, you can have that granola bar after. To the child, just having the safety of a granola bar in their pocket and access to food could completely disarm that trigger and lower their panic. And to the parent, they're still getting their way. The child's waiting until dinner. So by practicing universal precautions and kind of staying ahead of where we think the child might be triggered from, even if the triggers are unknown, we can really head off a lot of the responses to trauma that the child might have from seemingly everyday events. When we are armed with the knowledge of how trauma impacts the brain and its development, and we are empathetic and compassionate with our kids, we're not going to change the traumatic event or what happened to them, but we are going to take steps in moving forward and healing and making our house a safe space for them.